Hello, good morning, everybody. Could we take our seats and we'll go ahead and get started? I know there's a lot of you know each other, so we probably could spend the whole morning simply chatting and networking. Well, good morning, everyone. My name is Chris Callahan. I direct the Center for Aging Research, which is fast approaching its 22nd year of operation. And I also have a new role. I am the Chief Research and Development Officer at Eskenazi Health. And we'll be going back and forth this morning between here and Eskenazi. But the first thing that I want to do is welcome you all here this morning. It is an important step for the Center for Aging Research. And I know that many of our individual scientists have been working with many of the folks here in the audience for many years, but IUCAR is trying to get better at engaging your brains and your perspective and those of your stakeholders and clients in the very planning and organization and conduct of our research. And we are increasingly seeing that we have some really wonderful ideas that are impractical. And what we are trying to get from these types of relationships and from discussions and ongoing communication with folks in the community and on the front lines, we're trying to get more information on how to make our research applicable and how to make it practical and have it reach our patients and your clients sooner and at a lower cost and in a way that's scalable. So we have over the years done a number of different things to try to engage the community. Of course, many of us are providers ourselves, and so we have relatively easy access to patients in a medical setting. Many of our programs reach out into patients' homes, and so we also have access to caregivers and families. But we tend to be a little bit blind on our community-based services and supports, and we tend to be a little bit blind on a whole range of ideas that might be generated by people like those in the room here. So this morning, we want to begin to do a better job of welcoming you into this world of research and having you participate. So we are here to learn, and I don't mean only to learn about your day-to-day jobs and the challenges that you face, but we're here to learn about how to engage you more effectively in the design of research and in the conduct of that research. So thank you very much for being here. There are many of you know each other. I've already seen and said hello to many familiar faces, but there'll also be time for you to get to know some of the people that you don't know in the room. Next, I want to turn the morning over to Dr. Fowler. And she's going to give you a bit more of an outline of the morning, and also a bit more background about how this particular meeting came together.
Thank you, Chris. Good morning, everybody. We're really excited to have you here. A little over a year ago, I had proposed an idea to the leadership of the IU Center for Aging Research to think about how we could engage the community. As Chris mentioned, I think that's always been a goal of the IU Center for Aging Research to do research that matters. But as we sit here and the wheels turn and the sort of day-to-day business of research happens, it sometimes is hard to be able to engage the people who we're trying to serve, older adults and those who serve them. So I wanted to tell you a little bit about some of the things that I had proposed to the Center for Aging Research about what we had wanted to do and why I thought, and I think my colleagues think that this is important. So I think, first, you'll notice by the title, stakeholder. We call this a Stakeholder Summit. And I guess first, lots of people, if we asked you, you might have a different definition about what we mean by a stakeholder. So I thought it was important to at least sort of describe how we envisioned a stakeholder with the IU Center for Aging Research. And, the definition is pretty generic, a person or entity who's involved in or affected by a course of action. So if you think about the research enterprise, the types of questions that we study, the way that we do it, a stakeholder is anybody who we think about in that process. It could be a patient. It could be a caregiver. It actually could be a hospital administrator. And these are all popping up one at a time. So I sometimes think about the 7 Ps. And so I was trying to think of a way to have everybody remember how we were defining stakeholders. So I came up with this idea of the 7 Ps. And so today you'll hear the word stakeholder and think about all of these groups because we mean them, right? They're patients, which are those who care for them, patients, families, caregivers, the public, providers, so nurses, doctors, pharmacists, therapists. Payers, I think sometimes we forget. Medicaid, they're a stakeholder in the work that we do. Medicare, purchasers, so employees who are part of the buying insurance and thinking about good healthcare and healthcare outcomes. Our friends down the street at Lilly, they're stakeholders in the work. And then principal investigators, it was a P, but what I meant is the scientists. So people like me and the others who you'll hear from today who do the research at the Center for Aging Research, and then policymakers. But I guess is the why. And, why do we think it's important to be able to have a dialogue with all of you when we think about the types of research that we do and hear from you about what you might like to see us do? You might hear a statistic, I don't know, later on that if you haven't already from some of us, that on average, they say it takes about 17 years for research that is shown to be effective to be implemented into practice. And that's not everything. That's the ones that actually make it into practice. 17 years is a really long time. Now, it's a complex issue, and there's a lot of reasons why research that is found to work never gets implemented into practice. But one of the arguments with regard to is the legitimacy and the relevancy. And so it's been shown, and I'll show you in a minute, that when stakeholders who have some kind of skin in the game in the research, it's not considered as relevant. And so sometimes the uptake is important. And so, for example, if we develop a program that we have shown to be really effective for older adults with heart failure, but all of the health systems who care for folks with heart failure can't think about how to implement that in their system, then there's a gap and it's not relevant to them. There's also a bigger impact, I think, on clinical practice and policy when we hear from the folks who have a stake in the game. And then it improves the value of research. And I think you'll hear a little bit of the story that I'll kind of tell later in the day. But I think sometimes, the value of what we do is informed by the people who we're meant to serve. So the overarching goal of having you all involved and all of us together involved in medical research is to generate evidence that's more relevant and useful to those making real-world healthcare decisions. And the hope is that this will increase the dissemination and uptake of research findings into clinical practice. And so this is a big slide, but I just wanted to highlight a few things that we know actually, now from the literature that one of the contributions of why research doesn't get implemented is because of the patient voice. And so here's actually a few examples. I think the one that I talk about a lot is there was a study that was done in 2010 that actually talked with surgeons and also breast cancer patients, and asking some of the exact same questions about what each thought was important. So what did breast cancer surgeons think was important to patients? What did patients think were important to patients? And we can see that 71% of the doctors actually thought that women keeping their breasts was a top priority for them, while actually only 7% of the women thought that. And so imagine if we didn't hear the voice, we may continue to do research around reconstructive surgery when it actually wasn't a top priority for the women. Similar, there's been research in psoriasis that has shown that what gets investigated frequently is, some very technical aspects of the lesions of psoriasis. And what patients say is, actually, I really want you to focus on things that are visible, like things on my face. Let's worry about that. And so I won't highlight all of these, but I think that we have now real data that shows when the research that's done doesn't match what the patients think is important, it's harder for it to be implemented. So I just wanted to briefly set the stage and thank everybody. You're going to hear today from a combination of some faculty members and researchers at the Center for Aging Research, and also a few of our community partners that we work with. And we've built in a fair amount of discussion after each session. We know this is a large group to have a lot of deliberation, but we really do encourage discussion and questions. I mean, our goal is to be able to have everybody leave here today to have a better sense on the kinds of work that we do, and maybe hear from all of you about what would be important for us to do that we haven't talked about. So next, I'm going to actually invite up Dr. Noel Campbell, and he's going to talk about the story of anticholinergics, which is a topic that we've been studying for a while here at the Center for Aging Research. Some of you may even heard snippets of this before. And so we've built in a fair amount, I think, of discussion afterwards, and then we're going to have a panel and hear from a few other folks.